The headlines are dominating global news feeds. A severe, highly lethal respiratory virus has broken out on a luxury cruise ship in the South Atlantic, triggering international medical evacuations and widespread quarantine protocols. Social media is currently flooded with a singular, panicked question. Are we watching the beginning of the next global pandemic? The short answer is no. But the real story of what is happening aboard the MV Hondius? The biggest threat to your health is not the person sitting next to you on a plane. In most cases, it is the invisible, aerosolized dust hiding in your own garage. Welcome to our comprehensive medical breakdown of the 2026 Hantavirus outbreak. Today, we are going to walk step by step through the precise epidemiology of this event. We will debunk the viral myths spreading online, examine the history of the disease from its discovery in the 1950s to the tragic 1993 Four Corners outbreak, and explain exactly how this pathogen attacks the human cardiovascular system. Finally, we will explore the cutting-edge CRISPR diagnostic tools and mRNA vaccines currently in development that could neutralize this threat permanently. If you want the rigorous clinical science without the panic, you are in the right place. Let's look at the facts. In early May 2026, the World Health Organization received an urgent notification regarding the MV Hondius, an expedition ship carrying 147 passengers and crew. By May 8th, 8 individuals had fallen critically ill and 3 had died. Laboratory diagnostics swiftly confirmed the cause: the Andes virus, a rare, highly lethal member of the Hantavirus family. To comprehend the gravity of the MV Hondius incident, we must first understand the architecture of the pathogen itself. Hantaviruses constitute a specific taxonomic family of viruses known as Hantaviridae, which fall under the broader order of Bunyavirales. Unlike highly contagious respiratory viruses like SARS-CoV-2 or influenza, which rely on human-to-human transmission to survive, hantaviruses are fundamentally zoonotic. This means their natural existence is tied to animal hosts. Specifically, wild rodents serve as the lifelong reservoirs for these viruses, carrying them perpetually without ever exhibiting signs of illness themselves. While symptoms were documented in ancient texts, modern medicine did not isolate the virus until relatively recently. In the early 1950s, UN troops near the Hantan River fell ill. During the Korean War in the early 1950s, thousands of United Nations troops stationed near the Hantan River began falling ill with a mysterious, severe illness dubbed Korean hemorrhagic fever. It took decades of relentless research before South Korean scientist Ho Wang Lee finally isolated the causative agent in 1978, naming it the Hantavirus, which gave the entire viral family its name. Today, epidemiologists divide hantaviruses into 2 distinct geographic categories, each causing a vastly different clinical syndrome. The Old World hantaviruses are predominantly found across Europe and Asia. These strains cause a disease known as hemorrhagic fever with renal syndrome, or HFRS. As the name implies, HFRS aggressively targets the body's blood vessels and the kidneys, leading to low blood pressure, bleeding disorders, and acute renal failure. While severe, the fatality rate for HFRS generally ranges from less than 1% to about 15%. However, the New World hantaviruses are a completely different and far more lethal entity. These strains, which are endemic to North, Central, and South America, cause hantavirus cardiopulmonary syndrome, or HCPS. Rather than attacking the kidneys, HCPS is a brutal disease that primarily targets the lungs and the heart, carrying a staggering case fatality rate of 20 to 50%. The global health community was largely unaware of the devastating potential of New World hantaviruses until the spring of 1993. In May of that year, a terrifying and inexplicable illness emerged in the Four Corners region of the United States, an area where the borders of Utah, Colorado, Arizona, and New Mexico intersect. The outbreak was chilling because of who it targeted. Young, completely healthy individuals were suddenly collapsing. Among the early fatalities was a 19-year-old long-distance runner. He developed flu-like symptoms and rapidly deteriorated, dying of acute respiratory failure on his way to the hospital. Investigators from the CDC were deployed immediately, but traditional diagnostics offered no answers. It was only through deep collaboration with Navajo community elders, who recognized cyclical patterns of disease tied to local animal populations, that a breakthrough was achieved. Epidemiologists realized they were dealing with an ecological cascade. The winter of 1991 to 1992 had brought a massive El Niño weather event to the region. Unusually heavy rainfall caused an explosion of vegetation, primarily piñon nuts, which provided a massive food source for the local wildlife. As a direct result, the population of the deer mouse, Paramiscus maniculatus, increased tenfold. With this massive surge in the rodent population, human-to-mouse interactions skyrocketed. researchers began trapping mice in the area and soon isolated a completely novel hantavirus strain. It went through several name changes, initially called the Four Corners virus, before being officially designated as the Sin Nombre virus, Spanish for the virus with no name. Today, the Sin Nombre virus remains the primary cause of hantavirus cardiopulmonary syndrome in North America. But importantly, like almost all hantaviruses, Sin Nombre does not spread from person to person. If the virus naturally resides in rodents, how does it cross the species barrier into the human bloodstream? The answer lies in the air we breathe. Infected rodents shed the virus continuously through their urine, feces, and saliva. When these waste products dry out in the environment, the viral particles remain highly viable. The primary mechanism of human infection is a process called aerosolization. When you enter a space that has been closed up, like a winter cabin, a barn, or a storage shed, and you begin to dry sweep the floor, you disturb that dried excreta. The physical action kicks millions of microscopic infectious particles into the air. Inhaling that contaminated dust provides a direct pathway into your respiratory tract. It is rarely about being bitten by a rat. It is almost entirely about sharing the respiratory environment where rodents have been living. This environmental reality brings us directly back to the 2026 crisis aboard the MV Hondius. How does a luxury maritime vessel become the epicenter of an outbreak? The answer lies in the specific strain of the virus that was identified, the Andes virus. The Andes virus is endemic to South America, particularly regions of Argentina and Chile. But within the vast family of hantaviruses, the Andes strain holds a unique and highly dangerous distinction. It is the only hantavirus strain in the world with documented, verified human-to-human transmission. While this person-to-person spread is uncommon, it typically occurs during close, prolonged contact with a symptomatic individual. In a 2020 outbreak in Argentina, contact tracing proved secondary transmission between household members. On the MV Hondius, the tightly enclosed environment of the ship's cabins and communal areas provided the exact prolonged, intimate contact required for the Andes virus to jump from the initial patient to others. This is why it was an emergency. What physically happens to the human body when it is infected with a New World hantavirus? The disease is particularly insidious because its early stages masquerade as common, harmless infections, delaying intervention. Following exposure to the virus, patients enter an asymptomatic incubation period that can last anywhere from 1 to 8 weeks. During this window, the virus is quietly replicating within the endothelial cells, the critical layer of cells that line the interior of our blood vessels. When clinical symptoms finally emerge, they arrive in two distinct phases. The first is the prodromal phase. Patients experience high fever, profound fatigue, and intense muscle aches, especially in the large muscle groups like the thighs, hips, and back. Many also experience headaches, chills, and gastrointestinal distress, including nausea and vomiting. Because these symptoms perfectly mimic influenza, early diagnosis is incredibly difficult. Standard serological assays are notoriously unreliable early on. But approximately 4 to 10 days after those initial symptoms, the disease ruthlessly shifts into its late phase. The virus fundamentally disrupts the integrity of the vascular endothelium in the lungs, causing the capillaries to become highly permeable. The blood vessels begin to leak massive amounts of blood plasma directly into the air sacs. This causes acute respiratory distress syndrome. The patient develops a severe cough, a feeling of crushing chest tightness, and rapid shortness of breath. The heart struggles to pump thickened blood through fluid-filled lungs, quickly leading to cardiovascular shock. Because there is no targeted antiviral cure, survival depends entirely on supportive care, utilizing mechanical intubation to force oxygen into the body and dialysis to manage organ failure until the immune system can clear the pathogen. However, the diagnostic landscape is changing. Researchers at the Korea Advanced Institute of Science and Technology, alongside UC Berkeley, have recently developed a revolutionary CRISPR-based diagnostic tool. By utilizing kinetic barcoding to analyze how quickly gene-editing proteins react to viral RNA, clinicians may soon be able to accurately detect the virus in a single rapid test long before late-stage symptoms. Given the terrifying clinical progression of HCPS and the dramatic evacuations from the MV Hondius, a massive wave of misinformation has flooded social media. To protect public health, we must aggressively separate fact from fiction. Let's address the most prevalent myths circulating right now. Myth number 1. Hantavirus is the next COVID-19, and we are on the brink of a global pandemic. The medical fact: this is unequivocally false. As the World Health Organization has clearly stated, while this is a serious infectious disease, it has virtually zero potential to become the next COVID. Hantaviruses do not transmit easily like coronavirus or influenza. Even the highly unique Andes strain requires prolonged, intimate contact. The risk of a widespread global pandemic remains exceptionally low. Let's look at the next myth. Myth number 2. You only need to worry about hantavirus exposure if you are hiking in deep forests, rural farmlands, or remote wilderness areas. The medical fact: exposure can happen anywhere rodents seek shelter. This includes urban storage units, suburban garages, basements, or any building that has been closed up and undisturbed for a period of time. This is an environmental reality. Myth number 3. It is perfectly safe to clean up rodent droppings in your home as long as you sweep them up quickly and throw them away. The medical fact: dry sweeping or vacuuming is the absolute most dangerous action. The physical force of a broom or the exhaust of a vacuum instantly stirs the infectious viral particles into the exact air you are breathing, directly causing aerosolized infection. Never sweep dry droppings. So, how do you safely neutralize the threat in your own home? Prevention is entirely dependent on safe environmental hygiene. If you discover rodent droppings, do not reach for a broom. First, ventilate the space by opening all windows and doors for at least 30 minutes. Then, thoroughly douse the contaminated area with a commercial disinfectant or a mixture of bleach and water. Let the liquid soak into the droppings for a full 5 minutes to destroy the viral lipid envelope. Once soaked, wipe up the material with a paper towel while wearing gloves and dispose of it in a sealed bag. Dispose of it in a sealed bag immediately. This protocol is simple, but it is your most effective defense against becoming an aerosolized case. Hygiene is the key. While environmental prevention is our best defense today, the scientific landscape is rapidly advancing toward a permanent solution. Moderna has confirmed ongoing clinical trials for an mRNA vaccine. Simultaneously, researchers at the University of Bath have developed a revolutionary vaccine prototype utilizing ensilication, a process that wraps the vaccine proteins in protective silica cages. This breakthrough allows the vaccine to remain completely stable without extreme refrigeration, making it ideal for deployment in the rural and developing regions where rodent-borne diseases hit the hardest. The 2026 hantavirus cluster aboard the MV Hondius serves as a stark reminder that human health remains intricately linked to the natural environment and the ecological balance of the species around us. By understanding the rigorous science, refusing to succumb to online panic, and practicing proper environmental hygiene, we can effectively protect ourselves from this rare but formidable pathogen. If you found this comprehensive breakdown valuable, please ensure you are subscribed to our channel to stay continually updated on the latest developments in global health and preventative medicine. Thank you for watching and stay safe. The information we shared today is a strategic blueprint to guarantee production of a high-fidelity medical communication tool. We'll see you in the next breakdown.